The CT coronary calcium score test measures the amount of calcium that's present in your arteries. A CT calcium score test is a quick and painless way to evaluate your heart health. It measures how much calcium is in your coronary arteries, which can indicate whether you have plaque buildup that might cause blockages or heart attacks. The calcium score test for the heart may be used to determine whether or not you have the risk of developing coronary artery disease. The presence of calcium in the coronary arteries in a patient without symptoms of heart disease is a well-validated risk marker for future cardiac events such as heart attack, sudden death, and brain strokes. A high calcium score indicates that there is a lot of calcified plaque in your coronary arteries, which puts you at more risk of heart attack and brain stroke. While a low score means that there is not a much calcified plaque, making you less likely to have heart attack or cardiac arrest down the road. Who should undergo CT calcium score is a big question. For that, your doctor calculates ASCVD risk based on your age, race, cholesterol levels, smoking status, blood pressure status, and diabetes status. Low risk is below 5%. Borderline elevated risk is 5 to 7.4%. Intermediate risk is 7.5 to 19.9%. High risk is defined as 20% or above. Coronary calcium scoring is indicated only in intermediate risk patients. We advise coronary calcium scoring only in select adults with borderline increased risk. Coronary calcium scoring is indicated only in intermediate risk patients. We advise coronary calcium scoring only in select adults with borderline increased risk. Routine CT coronary calcium scan should not be performed in patients at low risk or high risk. CT coronary calcium scan has no role in patients with symptoms of heart disease. We classify court calcium score as below. 0 score indicates no disease. 1 to 99 score suggests mild disease. 100 to 399 score is referred to as moderate disease. More than 400 score is a severe disease. CT coronary calcium scoring does not need any major preparation. Even fasting is not required. But, you should not take coffee or smoke a cigarette 4 hours prior. There is no need for drugs like beta blockers and nitroglycerin before or during the test. You will not be given any dye or iodinated contrast. So, it is even suitable for patients with dye allergies. But you should ideally be able to follow instructions given to you by court technician. You should lie still during scan acquisition. You should not move. You should hold your breath for 3 to 5 seconds when the technician says so. Consult your doctor if your calcium score is more than 100. He suggests you the best treatment based on your overall risk status. You need medical treatment when your calcium score is more than 100. Score less than 100 needs just healthy lifestyle changes. A healthy lifestyle is important for preventing heart disease if you have a high calcium score. The following are some of the things that you can do to maintain a healthy lifestyle. Eat a heart-healthy foods. Eat more fruits and vegetables. Eat less red meat and dairy products. Drink alcohol in moderation. Quit smoking. Do regular exercises. Maintain ideal body weight. Your doctor may suggest you take statins in case you have a high calcium score. Statins are a type of drug that can reduce the level of cholesterol in your blood. Statins are not just for people with high cholesterol levels. They can also be used to prevent heart attacks and strokes in people who have risk factors for these conditions, such as a high court calcium score. Do you need to repeat calcium score? We recommend against serial calcium scoring in patients with CT coronary calcium more than 100. Serial CT coronary calcium scoring to assess the efficacy of medicines is also not recommended. Patients with 0 score, repeat CT coronary calcium scanning is needed in 3 to 7 years depending on his risk profile. Summary of this video is: the CT coronary calcium score test measures the amount of calcium that's present in your arteries. Coronary calcium scoring is indicated only in intermediate risk patients. 0 score indicates no disease. 1 to 99 score suggests mild disease. 100 to 399 score is referred to as moderate disease. More than 400 score is a severe disease. Consult your doctor if your calcium score is more than 100.